are back and we're live at Devex World, and I'm joined by Patience Osei and Abdul Samed Zurak. Thank you so much for joining me, our J&J Fellows. So today we're talking about healthcare and how to design global health solutions. So Patience, I wanted to begin by asking you, given that you work primarily in academia, how do you make sure that what you develop and design is applicable in a given specific country context?
So thank you for that question. I'm a biomedical engineer and a human factors specialist at Johns Hopkins at the Armstrong Institute for Patient Safety and Quality. And a lot of the work I do is actually interacting with healthcare workers on the front line. So everyone from an EVC associate that cleans patient rooms all the way up to the epidemiologist. And what I do is I observe their work. I do interviews with them. I have focus groups with them to try and understand their challenges and help to design innovations that work best with them and that are kind of their ideas. So it translates over very well actually to my work in global health, because what I did during the recent Ebola outbreak is I worked with over 200 healthcare workers on the field, some of them in America, most of them in Guinea and Liberia, and I observed what they were doing, and I really spoke with them to understand the challenges and then come up with solutions and innovative personal protective equipment to protect them from dying, because over 500 of them died during the Ebola outbreak.
Yeah, it's amazing to hear how you go about designing those kinds of very specific, that protective wear, for example, in that context. And Abdul, shifting slightly from pandemic response, could you tell us about your work at Zurak Cancer Foundation and some of the innovative tools that you use in your work, and how were they designed with the user in mind?
Okay, so when we started Zurak Cancer Foundation, we were visiting communities. We had an initiative called the Free Community-Based Screening Program. And when we were doing that, we felt there was a very huge disconnect between the people within the communities and our initiative. So we were recording very low impact. But we came up with very much innovative solution to try to mitigate this problem. And we came up with an initiative called the Visualize Project, trying to connect to community health nurses and trying to deliver free screening program in these various communities. And one of the things that we came up with an initiative called the MSSI project, where we are going to provide fundamentals in oncology training for community nurses in order for them to be able to deliver oncology services in our various communities. And also we came up with an innovative tech solution called the Ghana Oncology Map, where we are going to use technology to map up an ecosystem of oncology in Ghana with medical professionals and these community health nurses in order to improve outcomes in the less privileged communities in Ghana. Yeah.
It's really interesting. And so obviously one of the key challenges in global health is access to care.
Yeah. So
how do you make sure that your health initiatives reach rural communities?
Yeah, so our portfolio is access to quality healthcare. So with the Visualize project, we are going to be employing 648 community nurses, and we are going to contract them to run 100 screenings per year in our various communities in Ghana, and which gives us an impact evaluation of 64,800 evaluations by the end of each and every year. And also with the MSSI project, we are going to equip the medical professional within these communities with the necessary skills and resources to be able to provide primary oncology interventions in our various community. And with the Ghana Oncology Map project, it will enable us to connect specialists with community nurses and the local people or midwives within the communities, and also improve the health outcomes by providing them access to facilities and resources, and also specialists that will be able to reach out to them, and also connect with them in post-surgical management and case management when it comes to oncology in Ghana. Yeah.
Yeah, it's a really important program. And Patience, back to what you were saying earlier about your work in the Ebola response effort. What lessons are you taking from that experience and applying in other global health contexts?
I would say that the biggest lesson that I learned is that you have to involve all the stakeholders. in coming up with an innovative solution. What the model that I like to use is called the spiral innovation model, which is a very iterative process. You work with the clinical teams on the ground, the people on the ground. You work with the technical people like me that are engineers, but you also work with the organizations that kind of have a big say. For example, we worked with USAID. We worked with DuPont, which is a company that manufactures personal protective equipment, and we worked with Japaigo, which is a nonprofit on the ground that helped us to test the suits and get it out there. But a second lesson that I learned, which actually came about when I was in, I think it was Guinea in 2016. I was sitting in a room with about 15 healthcare workers. We're trying to, I'm learning about their needs, learning about their challenges, and they'd given me feedback on my designs, right? And we're in this room doing important stuff, but all of a sudden there was an emergency. Someone rushes into the room and says, you guys have to leave. And it turns out we were at a Doctors Without Borders facility, and they were one of the biggest responders in the outbreak. It turns out that they had the last Ebola patient in the unit at that time, which was a few-month-old baby whose mom had passed away in childbirth, and the baby was in critical care, right? So this brought it to my perspective that this is real. These are real people. These are real needs that have to be addressed with urgency because people are dying, right? So that was the thing that tied it all in for me, is that the need is great, and it's immediate. And whenever something like this happens, we have to respond, but respond very fast. So that was the biggest lesson I learned. And it's about the impact that our work actually has in the field.
And what's your call to action to guard against the next pandemic?
So I strongly believe in empowering people on the ground. So empowering the healthcare worker to know that they can come up with their own solutions. They see the challenges every day, and they can speak up and tell us what they need, and we can come up with innovative ways to do it, but also empowering innovators on the ground. Like myself, I'm from, Botswana, from Africa, and there's so many creative people out there in Africa that are just not empowered. I came to study in the United States of America on scholarship from my government, and I was empowered. I was educated to harness my skills, my design skills, and I was able to make a big lasting impact. So I think the future of healthcare is really in empowering people on the ground, healthcare workers and young people that are innovative.
Absolutely. And Abdul, I wondered if you could talk a little bit about innovations that you're planning for the future in your work. I know that you're looking to take the project to scale. If you could talk a little bit more about that and how you plan to do that.
Okay, so we are trying to develop a 5-year strategic plan for the organization, and it's all about innovation. So we are using technology for our financial, we are using technology for our monitoring and evaluation, we are using technology for our healthcare delivery. So it forms a core part of our organization, and the major stuff that we are working on is the Ghana Oncology Map, which we are going to build a very robust system within the next 5 years. We are going to make sure that we include all oncology specialists and all oncology service delivery organization and all that on the system, and also enable the community to be able to connect with them. It's going to be like the Uber of oncology service in Ghana. Yeah, that's how the system is going to be like. Yeah.
Okay. And speaking directly to young people, either in your community or globally, what's your kind of key message or piece of advice about taking action at a community level?
Yeah, I would just say that the biggest leaders or the biggest business leaders around the world became great today because they solved a problem. So as a young person, if you want to be great, you need to solve a problem, because if you don't solve the problem, you become the problem. So whatever way you can contribute to your society and improve the outcomes of your community, do it, because you are building a better future for yourself. Yeah.
That's great. That's really inspiring. And Patience, the same to you. What's your call to action to young people looking to take action in their own community?
Don't be afraid. Don't be afraid to stand out, to stick out. I always say this. I was, one of the only women of color the only woman of color in most of my classes. In most of the rooms that I stand, I'm the only woman of color, the only African. But I had to get out of my comfort zone. So do the same. Don't be comfortable. Don't, just follow the status quo and complain. Do something. You're skilled, you're talented. Use those skills, use those talents, and be the change that you wish to see.
Thanks so much for those really strong messages. Thanks for your time and all of your work.
Yeah.
And thanks to everyone watching, and stay tuned for more throughout the day.